Hi, so my name's Cath Gormally. I'm Director of Adult Social Care in Salford Care Organisation. That's an integrated organisation with social workers and adult social care workers working within the NHS and employed directly by the NHS. Salford Care Organisation is a partnership between Salford City Council, Salford CCG, and Salford Royal Foundation Trust. We've also got a wider partnership called Salford Together, which is the widest local system partnership alongside a very vibrant voluntary and community sector. The particular relationship with the care organisation is unusual in that adult social care, TUPE transferred in 2016 all their adult social care social workers and the social care workforce in its entirety. I've had a long history of working in mental health services. So my background is a mental health social worker, and I worked in various social work leadership roles, always working across that integrated partnership with health and social care and kind of bridging that gap really between social work and the NHS. I'm really passionate about social work generally with adults, and particularly I've got a particular interest in mental health social work. I have that passion because I know, having been a mental health social worker, just what a contribution mental health social work makes to people's lives. They focus on the social determinants of ill health, so things like poverty, education and training and inequality. I think mental health generally has been the Cinderella service of the NHS for a long time, and mental health social work even more so. So I think now is the time, because we've got more, promise of more resources into mental health, to also kind of prevent worsening mental health and really kind of intervene at an earlier stage. I think the Care Act that was implemented in 2015 really gave us an opportunity to kind of reframe our focus on social work generally, and it gave us a permission to kind of put good practice into legislation, and to put that good practice back into our social work. I think I'm thinking about things like having a strengths-based approach to our social work rather than a deficit-based approach. So really looking at what people are good at, what they want to do, how they can live their lives to the full, and also live with a mental health problem. So it's not about necessarily curing that mental health problem, but getting by alongside it. I think the arrangements that we've got are really beneficial because we can work together to develop a shared culture. So we have collective responsibility for both health and social care. We've broken down barriers between health and social care, and we're able to lead strategically and operationally to really bring the best benefits to our local population and our service users and carers. So for example, in terms of making care more seamless, reducing duplication. So when we were separate organisations, the NHS would do an assessment and then maybe refer to a social worker in adult social care. That would take some time to deliver the referral, and then the social worker would go out and do a separate assessment. Now that we've got social workers and district nurses and doctors working together in the same teams within the hospital and within neighbourhood teams, we're able to reduce that bureaucracy, and the person who is receiving the service only needs to tell their story once. Within our integrated care organisation in Salford, I think social workers are really valued, and I think they're really valued because we work so closely together. The benefits and contribution that social workers are able to make are better understood. I think the morale of mental health social workers nationally is probably pretty low, if I'm honest. I think that's because we don't celebrate them enough. We don't celebrate the fantastic contribution that they make. And I think in many areas, the contribution that they make isn't fully understood. The most important things about partnerships are integrating our functions. So it doesn't really mean that organisations have to structurally integrate and transfer staff into one organisation. But I think the most important thing is to integrate our functions. So for social workers to be working side by side with other professionals in a multidisciplinary team way, and for senior system leaders to be working together collectively and collaboratively and not in competition with each other for the benefit of the place. So for NHS trusts who either directly employ social workers or who manage social workers on behalf of local authorities, having that guidance to ensure that social workers are supported sufficiently is really important. We've got to make sure that social workers have opportunities for continuing professional development and career opportunities within the NHS. I think what's great about mental health social workers is that they can really make a difference to people's lives, and they can really change lives. They can help people stay independent in their local communities and their families for longer. They can avoid hospital admissions. They can really help people get their lives back. I think that's what's really important.